Welcome to Western Insights. Today's show is brought to you by Western's College of Business and Economics in partnership with the Western Alumni Association and Foundation. Our intention with Western Insights is to extend our expertise far beyond the classroom with our own internal subject matter experts and external guests. Last week, we marked 1 year life in a pandemic. Nearly every aspect of everyday life has been impacted for all of us, whether you are 60 or 90, employed, retired, no matter your health conditions, things have changed undeniably. One of the things that has changed is national conversation about equality. As we stumbled through the last 50 some weeks, we became aware of how some people were impacted very differently as society pivoted work, school, healthcare, etc. For some, it was an adjustment, while others, it was a disaster. Unfortunately, some of those equity concerns are not new. They had just become undeniable. In other cases, new conditions allowed new concerns to arise. But which is which, and where do we go now that we see them? That is the challenge in front of our panel today, and they deserve our thanks from the outset. This is not an easy discussion for anyone, but it's a discussion that we should start and continue to have. We're going to explore this topic from 4 lenses today: health, education, workforce, and the broader economy. To help us along the way today, we have Dr. David Hansen, who began his career working in finance and marketing. After participating in numerous volunteer medical missions to Central America, Dr. Hansen left corporate America to pursue a life in medicine. Dr. Hansen earned his medical degree at Brown University School of Medicine. He then completed his training at the Tacoma Family Medicine Residency Program. He's a board-certified family physician and has been with Western Student Health Center since 2017. Currently, he is the Associate Medical Director. Michaela Miller is the Deputy Superintendent at the Office of Superintendent of Public Instruction, commonly referred to as OSPI. The Deputy Superintendent oversees a variety of divisions and programs within the agency, including assessment and student information, educator growth and development, learning and teaching, special education, special programs and federal accountability, student engagement and support, and system and school improvement. Michaela has been honored for her service and leadership by the Washington Association of School Administrators Service to Washington and the Association of Washington School Principals. Michaela holds a Bachelor of Arts degree from Western Washington University, a fine place, go Vikings, a master's degree from Gonzaga University, and a doctorate and superintendent credential from the University of Washington. Dr. Miller also holds a Washington State Principal certification from Seattle Pacific University. Annalise Van Sherman has served as a regional labor economist with the Employment Security Department since February 2010. The region she covers includes King, Snohomish, Whatcom, Skagit, Island, and San Juan counties. Annalise works closely with economic and workforce development partners throughout our region and statewide, providing local labor market intelligence to help inform strategic decision-making. Annalise has a PhD in economic geography and a master's degree in economics, both from the State University of New York at Buffalo. Serving in a dual role today as both a panelist and moderator is our own Hart Hodges. Hart received his PhD in economics from the University of Washington. He's taught economics at the University of Puget Sound in Tacoma and served as the natural resource damage assessment economist for the U.S. Department of the Interior. Hart has also spent several years working with an economic consulting firm in Alaska. He joined the faculty at Western in the fall of 2000. His research interests include natural resource and environmental economics, health economics, and applied business economics. In addition to serving as a faculty member at Western, Hart co-directs the Center for Economic and Business Research. A little housekeeping before we dive in today. Closed captioning is available for this event. Using Zoom, you may activate this feature at any time through the closed captioning button in your menu bar. Some of you have submitted questions with your registration, and we really always do appreciate seeing those. If you have additional questions today, which we're pretty sure you will, please use the Zoom Q&A feature, which is also in your Zoom menu bar. We will be responding to questions in the last half of the discussion today, so don't be shy to send those in as you have them as different speakers talk in the beginning. Okay, Hart, let's dive in.
Thank you, James. I'm looking forward to this discussion. It should be fun. We're going to start with each of us doing a short talk about disparities that we see in our unique areas. You've already mentioned health, education, workforce. Then we're going to try to bring it together by talking about how they're all connected, and none of these areas are islands in themselves, right? So, David, I want to start with you. I think the medical side is just a very easy starting point for a lot of different discussions that has to be considered when thinking about education or workforce. So, David, I'm going to turn it over to you.
Thanks, Hart, and thanks again for inviting me today. I think the COVID pandemic really has continued to deepen health disparities in our country. These are longstanding inequalities that have been around and unfortunately have increased the risk for COVID illness and death for many people. These risks really are the result of the imbalances in where people live, work, learn, play, and age. And so what I'd like to try to do is briefly cover some areas about some of these social determinants that affect health. That includes health and healthcare, um, neighborhoods where people live, issues of food insecurity, and I'll touch briefly on occupational and job conditions as well as education in a hope that we can expand further discussion with our other panelists. So first, I want to share some kind of disheartening news. When we look at evidence for risk of severe illness from COVID-19, Black or African American, Hispanic, and Latinos are roughly 3 times more likely to be hospitalized from COVID and just over 2 times more likely to die from COVID infections. Another group that is severely impacted are the American Indian and Native Alaskan people, who are 3.7 times more likely to be hospitalized and almost 2.5 times more likely to die from infection. So this is a very real issue, and healthcare is one of those areas that is severely impacted by this. I think in general, groups of color tend to have, there's issues of lack of access to quality healthcare, health insurance, and more importantly, culturally responsive healthcare that it can address certain issues related to language and the way people live and work together. Folks in these groups may also are more likely to have underlying medical conditions, diabetes, hypertension, obesity, chronic kidney disease on dialysis, chronic congestive heart failure. All of these can increase the risk of death. Because of other factors that play a role here, these groups tend to have trouble accessing urgent or emergency care. Again, delaying care can increase the risks of illness. And then there's been a historical precedent as well. Inequities in treatment may result simply in the distrust of the government. And so this has played out in recent issues related to testing. Just simply getting a test, minorities are more likely to be tested for COVID-19 in a hospital setting instead of outpatient. And if they're getting tested in the hospital, that means that they're more likely to have severe disease, which can lead them to have more risk of being admitted to the intensive care unit, intubated, or having a breathing machine started for them, or dying. These factors are related to transportation, issues about the potential costs for testing, lack of paid leave, so folks have difficulty getting time away to do that. And so what I wanted to do is touch briefly on some of the other social determinants and then open this discussion, as I mentioned before. So one of the other big areas that we struggle with is just neighborhood and physical environments. The risk of exposure and illness are greater in groups that live in areas with high rates of infections or a higher incidence. They tend to be in more crowded living conditions and unstable housing situations, which can increase transmission. Many families are multi-generational and live together, again, increasing the risk. And because they're together, it's very difficult for folks to self-isolate or to self-quarantine. And then spread can happen very quickly in these cultural groups. Again, Lack of transportation is another key factor. Folks are stuck where they are and often are unable to work from home. There's also, because of the high employment rates in these groups, there's also a risk of eviction or homelessness. And so that can be also stressful. Related to that is food insecurity, which is a very important component because it's associated with poor health. In 2016, a study showed that non-Hispanic Black households were nearly twice as likely to be food insecure than the national average. And this can severely impact basic needs as accessing healthcare and being able to get a job or pay rent. Other factors include occupational and job conditions. Folks in minority groups tend to work in the essential work settings like healthcare, farms, factories, warehouses, food processing. And these jobs really increase the risk of exposure to COVID-19. And many of these folks are unable to work from home. They also, as I mentioned before, don't get paid sick leave often with these jobs, and they have less flexibility in leaving these jobs. And all of this ties back into the questions of health, healthcare, and access to health insurance. And many studies have shown that lower income leads to shorter life expectancies and an increase in the risk for underlying medical conditions. From an education side, there's significant inequities in access to high quality education. Hopefully that has changed some as a result of providing technological solutions for students who are trying to study from home. But I think a key point here is that non-Hispanic Black and Hispanic or Latino participants in programs had lower levels of general understanding about COVID and about the prevention practices that they needed, the symptoms, and how to seek care. And as a result, that ties back into potentially having delayed care and then becoming sicker because of that. And so I think, you know, all of these components weave together to create a setting that makes it difficult in general. And I think these are issues that have been around for a long time. But unfortunately, COVID has really, really exacerbated that. So I think what I'd like to do is hand this over to Michaela and add some more insights into what the educational perspective might be. So thanks again.
Good morning. Thank you, David. My name is Michaela Miller. I'm the Deputy Superintendent here at OSPI. I'm going to talk very high level about state level inequities in our system from an education perspective. Obviously, they dovetail really well right now with our healthcare as well as workforce issues. And I know we're touching on all three of those pieces together, but over the last year being in this position, and we hit our 1 year mark on February 22nd when we had the first phone call from a school superintendent that said, there's something going on up here in the Snohomish County, and we need to talk about it. And from that day forward, our lives have been drastically different here at the State Education Agency at OSPI. All of the data and information that I share today is at a state level. And so I want to couch this. I think it's important to remember that each school district, each school, and I know I'm a parent of a public school student, and many of our listeners are too. And so I want to just couch it with the data I'm sharing is at the state level, and so it's rolled up, and each district or school might have unique your own unique experiences. So just want to caveat my remarks this morning with that qualifier. Never have I thought I would be so linked into the Department of Health and working so closely with another state agency that up until this point, we really have not been as connected with. Of course, we do have overlapping work, but this unique experience over the last year have really caused us to kind of reassess our relationship with that agency. And I just want to make sure that I say I cannot imagine not having the quality folks at the Department of Health and local health officers throughout this pandemic. It has been a very amazing, and they are heroes in my mind for what they've done throughout the state of Washington. So equity is not new. The whole conversation around equity is not new to education. Of course, we've been focused on that and then really refocused our energy over the last year. But it isn't something that's new to the field of education. However, everything over the last year has sped up our laser-like focus on equity issues. And I want to go over just 5, and I'm going to do this at a very high level, but 5 areas that when I think of the inequities and the pieces that are going to be in play as we think about recovery, because we've been really trying to shift our conversation to what recovery looks like in the next few years. This is not going, we're not going to get out of this in a few months, one summer, even one school year. This is going to be a long-term turn to recovery. And so we've been very focused on that. The first area I want to touch on is how important in-person instruction is and how much we've realized how important it is to be interconnected in our communities with our schools. In many places, the schools are the hub of the community. They offer supports well beyond academic support, social emotional supports, human services, social services, nutritional needs. All of those pieces really are set the stage for, if you take that component of in-person learning away, we've seen the dramatic effects on students. And so that in-person learning is key. As of March 31st, 63% of our elementary students in districts were offering either a hybrid or full-time in-person instruction at their grade level. So we've seen over the last, and we've been calling this a glide path. It is not a light switch. I know many of you have heard that before, but our school districts can't just turn on a light switch and then have students back in person. So as we've been on this glide path, we've seen a tremendous increase based on health and science, elementary students coming back first into an in-person experience because of the 6-foot physical distancing, which I know is in the news this morning and has caused me to be up and on phone calls for quite a while now. That obviously we're in a glide path to a more normal experience, but we're not there yet. And so, so because of that 6-foot physical distancing and the footprint of schools, they haven't been able to introduce full-time in-person instruction in many school districts. Some of our smaller school districts have been able to do that. As of March 1st, 43% of our middle school students had some in-person, hybrid, or full in-person experience. And about 26% of our high school students had some in-person learning. Anyone that is familiar with how school districts operate might understand how complex it is to cohort and do small groups in a high school just by virtue of the way our high schools are set up. And so that's been a challenge to redo schedules, redo master schedules across the district, figure out which teachers are teaching in person, which have accommodations to teach remotely. So it is an extremely complex planning process that school districts have been under. The second piece I want to talk about are academic and social emotional. And I mentioned this at the top. It is not just going in and doing learning. That's our primary purpose, but school districts offer a whole array of social services and supports for students. And so both of those pieces are key. Some of the data that we have coming out of, and I want to caveat this, that we at the state level only get academic or grade information for high school credit bearing courses. So that is, so we don't collect data on elementary or middle level non-credit bearing courses. And so we only collect that. So we have kind of a peek at how academically students are doing. And unfortunately, in the first term of this 2021 school year, 25% of high school students had at least one course where they did not earn credit. It doesn't mean they necessarily received an F, but they may have received no credit or an incomplete. School districts over the course of last spring really dramatically in lots of places changed their grading practices for high school, which we encouraged, giving kids more flexibility and more time, and focusing more on the standards of learning rather than just completing assignments. And so we see that is an increase from last year of 42%. So we definitely are seeing students receiving those Fs or no credit or incompletes in the first term. And that's something that school districts will have to figure out how to move next year, support students over the summer, into this quarter and beyond, to support students to get the credit that they need in order to graduate. The third component that I want to touch on is our most vulnerable. If we talk about equity, looking at our students experiencing homelessness, looking at students in foster care, looking at the data that we have around our migrant students. Washington State is second in the country for the number of migrant students that we have in our state. And so this is a very large population across the state. And the challenge has been, because schools have not been open, the actual identification of students experiencing homelessness or migrant students has dropped. We've seen a 27% drop in the identification of homeless students, and districts are, it's very challenging when they're not coming to school to identify and support those students. So we know in the recovery efforts, that's going to be a primary focus, is reconnecting with those families, reconnecting with those students, making sure school is a place that they can attend and get support. And that is definitely part of the reopening and recovery plans that our districts are planning for the summer and the fall. The last two, one around funding and data, and I just want to touch on that. The funding and data obviously is disparate across the state. We have lots of federal funds coming in, but it is done through a formula that may not make up the difference for some of our school districts. And so that is something I can get into later. And then finally, I want to talk about workforce. This has obviously been a cataclysmic episode for many of our educators, our paraeducators, our educational staff, and many are facing experiences that they've never had before. And so we see, and I see major shifts on the horizon in our workforce. We've already experienced a decline in our teacher ed programs. And so I know many of our school districts have open positions right now, and they are definitely worried as they move forward about the workforce issues that were already existing prior to the pandemic that are going to be exacerbated by the glide path that we're on for the rest of the pandemic and as we move into recovery.
Okay, Michaela, can we use that as a transition to
Yep.
Annalise so we can?
Yep.
Yeah.
And that was my transition to Annalise.
All right, thank you. I'm glad to be a part of this discussion. There's so many topics that we could cover in this hour regarding the issues of equity and how this is playing out in the pandemic. But I think when I think about interconnectivity, there's nothing quite like a virus to show you just how interconnected people are and industries are and just our communities. this has really turned everything upside down in terms of the way that we are connecting with each other. And it's really shown us in many ways the inequities that already existed, but now are undeniable. It's visible. And I think, brings forth a call for action. I guess I'm going to just quickly describe some of the things that we've been seeing that are specific to this pandemic-induced recession and how that compares to other recessions. So when we're looking at COVID-19, one thing that happened is this escalated extremely quickly. We went from an unemployment rate in February statewide of 4.5% to 16.3% in April. So almost overnight, we just saw a jump in the unemployment rate to levels that we have not seen since the Great Depression. So this has been an unprecedented year. It escalated very quickly in a way that looks more like a natural disaster than what we might see in a normal recession. Similar to that natural disaster kind of paradigm, we saw policy directives. We saw stimulus payments put into place. We saw a policy response that expanded the availability of unemployment insurance beyond the usual safety net that it provides to a much broader definition, making it so that people are able to access unemployment insurance that might not normally be able to access it. The sheer number of people that have been impacted. As James mentioned in the introduction, for some people this was an inconvenience and an adjustment, and for some people it was an existential crisis. But everybody has been impacted, and we've seen when we're looking at different industries and occupations, and taking multiple different angles, everybody felt that jolt in April and has seen different ways of managing this as we recover. In the unemployment system, we're usually seeing about, as we entered into this crisis, we saw about 6,000 unemployment insurance claims per week entering in. And within a couple of weeks, we were over 181,000 in a single week in April, or late March, rather. And we continued to see the unemployment insurance information, coming in. There's a big divide in terms of the industries. Those industries that were impacted the most, first of all, every industry is impacted, but leisure and hospitality, this is our restaurants, our bars, our hotels, our stadiums, has seen the greatest impact throughout this crisis. Healthcare, another industry that has a lot of face-to-face interaction and has been impacted to a very large extent. Personal care services, construction, a number of industries that have a very strong face-to-face component have been impacted in terms of what we're seeing in unemployment insurance. There's at the other end of the spectrum, there are a lot of industries that have actually recovered fairly well. And a lot of what these share in common, first of all, the workers tend to have higher levels of education. The type of work is the type of work that can be done from home. And so the industries that have been the most resilient, and the workers, as a consequence, that have been the most resilient are those that have more access to education, that are able to work from home, that are able to access, that have been more or less buoyed by the ability to physically separate from other people and still do their work. I mentioned that this pandemic is also shares similarities to other recessions, and primarily what we're seeing is who is impacted. The question of, when we're looking at all this and shaking it out, taking out some of the specificities, who's impacted? The first people that were impacted disproportionately, young people, new entrants to the labor force. People that have lower levels of education, far more likely to show up in our unemployment insurance, far more likely to be displaced by this crisis. Low-income workers. In any given recession, we see the median income rise as we go into the recession, precisely because the first people that are being laid off are the people that have the lowest levels of income. And this does not differ from any recession. This is consistent with what we've been seeing. We also see that racial and ethnic minorities, people of color, tend to have higher unemployment rates in any given snapshot in time, and that's the case right now as well. When we look at the recovery, well, assuming, just looking at the unemployment insurance data, we know that we've been seeing people that are Native American, that identify as African American, showing up in greater proportions than other other ethnicities, other races and ethnicities, and that they continue to disproportionately represent a larger portion of people that are still on unemployment insurance. So there absolutely are some disproportionalities, and this ties in, as it's been mentioned, that we could be looking at this from a lens of geography, of education, of transportation, and access to healthcare, so many different angles. But overall, some of those same patterns that we see in any given recession are playing out today. And I'd like to just open it up for the discussion.
Well, I'm gonna jump in and steal the screen for a moment. Uh, Both Annalise and David have mentioned race and inequities. So I've got the top picture here is just unemployment rate, a reminder that rates differ by race across communities of color. And gosh, there's so many topics that we could get into that we cannot cover all of them in 1 hour with four people. David mentioned neighborhoods. That could trigger a conversation about environmental justice and health and connections between health and economics and so on. So we've got angles there we could explore. We had someone in the audience prod us to be careful that inequality and inequity are different. Very true, right? We often talk about some benefits. You can talk about the pros and cons of inequality, different amounts of healthcare consumed. That's not the same as equity. So we do need to keep in mind that sometimes in this show we're gonna use those words almost interchangeably, and that is not fair. We should be mindful of that. My confusing slide of the day, bear with me. Different industry sectors, financial activities, construction, manufacturing, retail. So the width of the various columns relates to the relative number of people in those sectors. Now, yellow lines, ability to work from home. And Annalise, I think you and I are going to come back to this later if we have time, but there's some jobs we can do relatively easily from home and some basically not at all. David, the red line, access to health benefits through your work also varies by industry sector. And then Michaela will come back, right? Because education also ties to health status. So we've got connections all through here. Annalise, you mentioned geography. So if you just glance at this map of the United States, don't get into the numbers too much. If you see a yellow area, half of the job growth from 2010 through 2017 occurred in the yellow areas. So we could also talk about rural and urban disparities and what's happening in terms of economic opportunity, rural versus urban, access to healthcare, access to broadband, and in this case, education, right? So we've got some striking divisions there. I'll wrap up by just saying my focus is often on income inequality, and there are access and equity issues here. The bottom four lines on this time graph that goes from the 60s to just about present are the bottom four quintiles. So if you're thinking about 4/5 of the population, almost no wage growth after you account for inflation. Noticeable wage growth in the top quintile, the blue line, and then we cheat with the dotted line, the top half of a quintile. So when I think when somebody says inequality, I almost always jump to income inequality and start from there, but I can't, right? I've got education, I've got healthcare, I've got so many topics. So let's open this back up. We've got a couple of questions from the audience that are more mechanical in nature, and we'll respond to those best we can in the follow-up. Michaela, there's a question for you that we're gonna respond to just in the follow-up slides on plans for schools. So I'm gonna try to get into the connections here. David, what sort of reactions have you had listening to folks? You know, significant structural changes in the labor market, communities of color. What comes to mind uh, when you were listening to Annalise, for example?
Well, I think that there's, as I was trying to say earlier, is that so many of these pieces are woven together inextricably. You just can't pull them apart from each other. And so, starting with education, if the educational perspective is not complete, then it affects income, it affects jobs, it affects the ability to get insurance, it affects healthcare access, it raises the risk of illness and many, many layers. So I think that this is, it's a very complex sort of struggle to bring an answer to what makes sense here. I think Annalise and Michaela's perspectives from income, wealth, jobs, education are what drive folks' ability to have access to healthcare in this country. And without sort of a socialized medicine model, it makes it very difficult.
Okay. And I'm going to hope we're going to got some questions for all of you. And I'm going to, if you can, keep your answers to 60 to 90 minutes so we can also get to some audience questions. Annalise, the coronavirus pandemic has caused significant changes in the labor market. What do you think is going to be long lasting, and how will the longer lasting changes, if there are any, how might those affect communities of color, or just or even just lower wage workers?
Well, I think one thing to consider is that when we're talking about economics or any of these different areas that we're looking at, we're talking about people and habits and ways that we navigate the world. And we've had a year of practicing separating from each other. And I don't think that that switch is just going to turn on as soon as everybody's vaccinated. I think we've got some entrenched changes in the way we interact with each other. I think technology has shaped a lot of how this has unfolded, with people that are able to access broadband technology and that are able to really tap into technology being at an advantage. I do think that we're going to see an acceleration of technological investment. We always do after recessions, but this time it's not just the question of cost of labor, cost of technology. It's now, we've all seen what technology can accomplish for us. And you've got the overlay of risk of face-to-face interaction overlaid with the normal cost and benefit. So I do expect to see continued effects that we would more than we would see after a normal recession.
And I think some of the technology you're talking about is easier to implement in, say, financial services than leisure and hospitality. So it's going to be interesting. It may cause some of the inequities that we're talking about in the labor market to continue longer than we would like. Michaela, how has COVID affected learning in students of underserved communities, and either access to or and do you see that? Are there signs of hope? Is dealing with some of the inequities when we think about some of the underserved communities?
Yes, I mean, obviously things have drastically changed since March of 2020 to now. On the upside, nearly every student in the state of Washington has a one-to-one technology device that is issued by the school district. Those were really Herculean efforts by the governor's office, who funded it, and then school districts that made sure they deployed electronic devices. We're seeing now, though, that is not sufficient for many students for in-person, that the importance of in-person learning is critical. So that connectivity has been definitely an issue in some pockets of the state that do not have access to broadband. They're using they really pulled out every stop, hotspots, setting up libraries that had internet connectivity, but that will still be a pervasive problem unless or until we have a statewide solution for that.
Okay, the terrible thing about closed caption is I get to read that I said 60 to 90 minutes on your answers. I should say seconds. No one called me out on that. David, telemedicine has expanded the reach of healthcare during the pandemic. Do you think it's been a meaningful bridge to underserved communities, and do you expect it to really stick?
Yeah, I mean, I think for many healthcare practices, including our own, telehealth wasn't really on the radar until we had to jump into it full force in March of last year. And so I think what we've learned over the last year is that it has been very useful. It has provided folks with access to our clinic that wouldn't have otherwise been able to make it here, especially since so many of the students are at home and not anywhere near campus to come into our health clinic. I think the same issues that Michaela pointed out apply to healthcare too, and telehealth, and that is, folks might have equipment or may not have equipment. They may have the equipment, but not the internet access. And that can, really cause some disparities. But I do think going forward, I think we will be seeing more healthcare providers offering telemedicine as an option.
Annalise, I don't know if it's a strange question. I may just be asking you to think out loud. When you're listening to David and Michaela, and you're thinking about economics and workforce, or in particular, or health or education, and the inequities in the different areas, do you see a starting point? Is education sort of the starting point versus healthcare, or vice versa, or is it more of a circle that you just have to jump in?
Well, I think it really is interconnected in a way that you can't just pull on one strand and expect to have your answer. I think this is all deeply embedded when we just think about, geography. Where are you located? What resources do you have? What do you have access to? Where can you get? What are your transportation options? What's your broadband? There's so much tied up that there really needs to be an approach that looks at all of these as many different strands as you can identify, but really to take that holistic approach and have that meaningful conversation that connects food security and education and health access and access to work. It's all deeply multifaceted and community-based.
And I'm not sure in the classroom that we connect the dots well enough. We certainly have someone from political science talking about inequities, and the same in environmental economics, but we're not very coordinated. And understanding some of these connections and getting people to think about how all the pieces do fit is probably crucial. David, we have a question from the audience on whether Medicare, Medicaid will continue to pay for telemedicine. Because we've had a bit more money and a bit more support from the payer side of the payer, patient, provider puzzle. Do you think that continues?
Wow, that's a great question. I think there's certainly been a lot of push from the American Medical Association, the American Academy of Family Physicians, and a lot of other groups that support primary care to make sure that telehealth is part of this. I think one of the complicating factors has been that each state requires certain licensing requirements for practicing. And until now, we are unable to practice outside of state boundaries and see folks. So if I've got a patient who happens to be living in Wyoming, Right now, I am unable to see them via telehealth. There is an act in Congress to try to even that out, but right now it is limiting. And I think that will be a big factor in determining whether insurances will cover it.
Gotcha. Michaela, when we're thinking in economics about health status, we often look at the correlation between health status and education. Do you see, or can you just comment on the role of education in reducing inequities in other areas like health status or income? I mean, Annalise was mentioning the role of education in different jobs. It's a key part of income inequality. So can you just think out loud about what role you see education playing in helping us address inequalities in health or economics?
Sure. I'm obviously K-12 is a basic ed, it's a constitutional priority for the state. Every state has a constitutional obligation to provide basic education for K-12. I think it's making sure that system has the resources it needs to support, particularly in light of the pandemic, as we come out of this, that we think about resource allocation in an equitable way, which I think in some cases, the funding coming from the federal government, the funding potentially coming from the state. Our state's done a great job in the last few years, particularly around settling McCleary and increasing wages for our workforce, for our educators. That's been a huge benefit to that. Attracting and retaining high quality educators is part and parcel with high quality education. So you can't separate those two. I would, and with all due respect for higher ed, I would say that there needs to be a reckoning around higher ed, both at the community college level and at the four-year level, so that there are more pathways that are available for students to access that high quality education that leads to a high paying job. So I think we're all in this together. It's not just a K-12 problem. We need to think about universal preschool. I know our superintendent has been vocal about that, but getting 3- and 4-year-olds ready for the K-12 system is absolutely critical. And it is disparate across across not just our state, but the entire country as to access for high quality preschool programs. So yeah, I think every part of the system has work to do.
Yeah, good comments. David and Annalise, I'm going to ask you a same question, 10-second answers with David going first. Has COVID, come back to what somebody started at the beginning, has COVID really brought about new problems and especially new inequities, or just highlighted existing things? David?
It has highlighted existing ones.
Annalise?
Ditto. It's highlighted existed inequities in our system.
Changing gears on you, Michaela. School districts can get waivers, I think, and you may correct me on this, so everyone has access to free and reduced lunch. Do you expect that to continue, or do you think it should continue?
Yeah, I think yes, I think it should continue. There are waivers, they're dependent on the USDA. So this is one place where our agency works with a different federal agency other than the Department of Ed. There's more to say on this. It's a very complicated issue. I will just say that in the last pandemic, over 100 years ago now, the school lunch program did come out of that pandemic. I love education history, and if you read anything about the last pandemic, some of the things that came out of that and were universal, school lunch programs was one of those things that came out of the last pandemic, and we decided, wow, maybe we need universal access to lunches when they're at school. And so we're looking for the things that we can grab onto that are important to the system and make those changes as a result of this pandemic.
Okay. We've got some comments from the audience that I'm going to try to weave into a question or two in the last 4 minutes. They focus on hybrid work And one question is sort of it's going to be joint between Annalise and Michaela, because more hybrid work might require more alternative learning models with families, I mean, where I live, where I work. So Annalise, hybrid work, huge change in the labor force. Looking out 2 or 3 years, do you think we're going to see a lot of people working, some remotely, some in office, or is that going to be fairly limited? What's your best guess?
I think that we've seen a lot of possibilities that have been exposed. So, a lot of things, the idea of, I work for a very large bureaucracy that might not have been amenable to sending everybody home to work under the normal systems, but we managed to do it. There's been a lot of learning by companies to figure out how to put this in action. There are also a lot of benefits to being co-located in a workplace. And I think there is going to be some hybrid model moving forward because people have figured out that it is possible to do some work from home. I do think this is going to also put some barriers in front of, while it opens up opportunities to a number of people, it also puts barriers in front of other people, in front of new entrants to the workforce, because now you may have a requirement to be able to build that flexibility in, to have familiarity with certain platforms. So I do expect it to stay with us in some form as we move forward. But we will return back to the office, maybe not 5 days a week, but I do expect to see kind of that hybrid moving forward.
Michaela, if they got a hybrid workforce, you may need a bit of a hybrid learning platform as well. I mean, we know we want kids back in the classroom for a variety of reasons, from mental health to social and different avenues of learning, but some families want to continue more remote learning, at home learning, just like some people want to at home work. Are schools going to be able to handle different deliveries at the same time, sort of a hybrid delivery?
So I'll just start with this and then I'll be really quick. Learning is a social activity, particularly for our youngest learners. Their developmental, any of the research that has been done on asynchronous, which is what they're calling it, asynchronous learning, has really been done in the higher ed environment. And as you go down in grades, I mean, we know this, if you've been a parent, you know this, the developmental ability for students to do asynchronous work obviously goes down as you go down in grades. And so our earliest learners, we don't want them on screens for 8 hours a day. They should be playing, they should be experiencing the social activities that are necessary to grow and develop. So I see the K-12 system adopting that. On a typical year, not a pandemic year, we have 1% to 2% of our students doing ALE in the past, in any traditional year. Now we probably will see a tick up in that. We're estimating maybe 7% to 8% of families will say, this works for my child, I want a remote option. I will say that is, that's very much a product of having an adult at home that's able to do that with our younger grades. So that too is an equity issue. So we expect some of that, but we know how important it is for in-person learning.
Excellent, thank you. So we have a couple of questions again, like what is being done about revising standards for healthy school buildings, that we're going to push that information out in a follow-up email or post related to the webinar. James, how are we doing on time?
I think I need to get the hook out. I think you need to wrap it up here.
So any takeaway comments from any of the panelists as we wrap up?
Hart, I think you hit the nail on the head just by asking about the inequities and that they are still exacerbated through this pandemic.
And hopefully this is just the beginning of a conversation. So I want to thank Michaela, Annalise, David, thank you very, very much. James, I'm going to hand it back to you.
All right. Well, yes, I do hope, David, I'm with you. I hope this is the beginning of a lot of conversations in a lot of communities. Mm-hmm. This is not a conversation that can be done by a single panel trying to summarize everything around the state. So it's each school district, it's each school building, it's each community, it's each county. It just keeps rolling up. Mm-hmm. So Thank you for joining us today for Western Insights. From all of us at Western Washington University and the College of Business and Economics, we want to thank you for joining us today. We also want to thank the Western Alumni Association and the Western Foundation for their support of this series. And we know that they would like us to thank those of you who chose to financially support the university as part of this effort. This and previous Western Insight sessions are available online. Yes, you can come back and watch this over and over and over again. No, there's a ton of other sessions. If you haven't watched other sessions, there's a ton of other ones, and we will make sure you get a link for that as well. We'll be sending you an email. Watch for that. It'll have, of course, the survey to ask you how you felt about the session, but there'll be further resources, as Hart mentioned. So be sure to take a look for that in your inbox either late today or on Monday. So with that, thank you to our panels. To all of you in the audience, have a great day. Stay safe, mask up, and remember, you and your actions are a key part of our long-term recovery effort.